Hi, everybody. Welcome. I'm going to be talking a little bit about health promotion today. So, my name is Becky, and I have a background in kinesiology and then health promotion, and I did an interdisciplinary PhD. My research interests are around environmental, societal, and gender influences on health. And I'm currently an instructor in health promotion in the School of Health and Human Performance, and I'm also our internship coordinator and honors coordinator. So what is health promotion? Health promotion is a pretty new field, actually. So it's just emerged from the 80s or so. And it started to stem from this idea around individual healthism that came about in the 70s and 80s, where we had this tendency to focus on individual responsibility for health and tried to do a lot of education around diet and physical activity and tobacco use. So we started to realize that that stuff wasn't actually that effective and we weren't making a lot of change. And so we started to change our focus to be more environmental and political. And that's where the field of health promotion began. So here are a couple of definitions for health promotion. The first one comes from the Ottawa Charter, which is a really important foundational document for our field. And it says health promotion is the process of enabling people to increase control over and improve their health. And more recently, we have another definition that looks at the planned combination of educational, political, regulatory, and organizational supports for conditions of living that are conducive to health. So health promotion often tackles complex issues. So complex issues are ones that don't have simple solutions or that can't be solved by traditional science or educational methods. And they often have really big causes, things that relate to societal, historical, cultural, economic, and political causes. We work towards prevention a lot in health promotion, and we can only really prevent health issues if we understand how they're truly caused. So in health promotion, we tend to dig really deep to look at root causes, or what we call the causes of the causes. So here are a few kind of key considerations for health promotion. We want to think about what place health has in our society, what influences health, who or what might be responsible for health. And here are a few key concepts. So we keep equity, diversity, and inclusion really at the center of what we do. We're focused on social justice, on power dynamics, and on community engagement and development. The social determinants of health is also another really important part of health promotion. And this is the perspective that health isn't really just shaped by medicine or by choices, but by living conditions. And living conditions are the circumstances in which people live and work and play and grow. And those circumstances and conditions are shaped by how things are distributed. So how money, power, and resources are distributed across populations. So this is the list of the social determinants of health. You can see them all here. They include things like gender and race and disability and indigenous status, and then also access to things like education, food, health services, and good employment conditions. So this is a really interesting example. So when we're looking at health, we often do look at obesity as a complex issue. And this diagram is to show you just how complex obesity is. I think sometimes it gets a bit oversimplified to be about just nutrition or physical activity, and it's way more complex than that. So I know you can't read this diagram, and that's okay. The little tiny colored boxes all indicate one of the factors that relate to human obesity. And then you can see the interconnectedness of these factors through all of those little lines, and it ends up just looking like a plate of spaghetti, and so we can tell it's really complex. So just one of those factors we might consider physical activity. So one of the things that we can look at for physical activity, or specifically the physical activity of children and youth, is looking at the fact that federally, or in Canada, we don't actually have any national physical education policy. So each province will have different policies and guidelines for how physical education is done in schools. This could include the way teachers are trained, what curriculum guidelines exist, what graduation requirements there are, and there are all kinds of complex acronyms and things that we do, things like physical education, quality daily physical education, daily physical activity, and those will all differ between provinces and across schools and school boards. We did previously have what was called the Child's Fitness Tax Credit, which was a federal tax credit and it's been discontinued, but we should examine things like tax credits and what might be the limitations of those. So one of the big limitations of tax credits, and specifically looking at the physical activity one, is that it's focused on individual families, and more specifically, individual families who can afford to enroll in programs and those who pay taxes. Now, when we do this, we give just a little bit of money here and there to individual families, we're taking money away from what might actually be a bigger, national, more effective, or more efficient strategy that could influence more people broadly. Looking at individual folks and only addressing the issues of individual folks also really doesn't do anything to address those social determinants of health or to change living conditions or circumstances. And tax credits can also perpetuate a discourse that relates to individual responsibility for health instead of looking at health as a collective responsibility or as a population health concern. Looking at physical activity also relates to nutrition. So we can look at school food nutrition policies and strategies. We can look at how children and youth are influenced by advertising and industry. And we also have to look at things like active transportation, sidewalks, safety, and neighborhood security. So at a minimum, if we start to address these issues, we have to have policy that relates to housing, transportation, urban planning, education, and industry. And that's really, really complex. So health promotion is going to look at health from a really critical and comprehensive standpoint. We're going to examine those living conditions, the social determinants of health. We use population approaches rather than focusing on individuals. We always focus on health equity and social justice, and we really start to explore and examine the social, historical, political, and cultural influences on health. So in short, we got a lot of work to do. So these are some of the courses you might take in health promotion. So we have introductory courses in health promotion theory and policy. We have courses in community development and strategies. We have lots of fun electives, so things in mental health promotion, disease prevention, human sexuality, drugs, and comprehensive school health. Folks often ask what they can do after they finish a health promotion degree. So our degree program actually wraps up with a 14-week internship placement. And I think looking at the places people go for their internships often give us a good idea of what people are doing in the field of health promotion. So our internship placements are the last semester of your degree program, and they offer a combination of work and academic assignments. They also offer lots of great opportunities for you to do some practice in the field, for you to start building your networks and connections, and for you to really dive in to explore your passions and interests in a particular field. So we've got lots of really cool placement opportunities available, and you can really pick from lots of options. So right now we have folks who are interning at community organizations, so places like Heart and Stroke or the Canadian Cancer Society or other community health centers and organizations. We have folks who do government or quasi-governmental placements, so things like health authorities like NSHA or with school boards or School Plus. We've had folks go to the Public Health Agency of Canada and through provincial departments of education or Department of Health and Wellness. We also have folks who do more research-focused internships, so sometimes people will go to research institutes, labs, or groups. And then we have folks who, when they finish up their degree, go on to do future studies. So health promotion makes a good intro for people who are interested in grad programs that are professional, so things like occupational therapy, social work, nursing, medicine. We have folks who go on to kind of more health-focused graduate programs, so we offer a master's in health promotion as well, or people go on to public health or health admin. And then people sometimes use health promotion to go beyond health as well, to look at things like urban planning or public administration or an MBA or even law. So that's it for an intro to health promotion. I hope you enjoyed this little lecture. Please feel free to reach out to us if you would like more information or have any questions. Thanks so much for listening.